Okay then, Danny, it's alright, please have a look at Alex and see how he's doing and make sure everything's okay.
Yeah, what are you going to be doing with baby?
We're just going to do a top to toe basically and just make sure everything's in the right place. He's got 10 fingers, 10 toes.
Yeah, that's fine. Yeah.
Lovely, thank you very much.
This year, a record number of students are training to become midwives.
And then we'll just measure. We're going to feel for the posterior fontanelle, all over to the anterior fontanelle. Feeling great, and there's no moulding as well.
These new recruits are in their first year of a 3-year degree course at Birmingham City University.
Here you go, here's your vitamin K.
I need 2 midwives to check it for me. I'm actually not qualified to do so. None of you are.
They'll split their time between academic study in the classroom and hospital and community training placements.
Thank you. So everything's fine and normal?
Everything's absolutely perfect, yeah.
Well, bye baby, that's it now.
First-year student Rebecca is from a family of midwives.
Both my grandma and my mum were midwives, so it's something that I've grown up around. They've been very open and honest about the role and what can be expected and how difficult it is. It's not all just sort of walking into a room, delivering a gorgeous, healthy baby to a lovely, healthy, fit mother, because that's not what the job is, unfortunately.
She's been studying at the university for just 3 months. Tonight, she's starting a 4-week placement at Birmingham Women's Hospital on the night shift.
It's just going to take quite a lot of getting used to. I've obviously never worked at night time before. Am I going to get through the door and then become really tired? It's very strange getting ready for a night shift.
Student midwives are recognised by their white uniforms. A single chevron is sewn onto the sleeve for each year of training.
As a first year, I think it's highlighting, obviously, with red, the fact that we might not know everything quite yet. I've never sewn on a sleeve in my life, but we're going to be sewing up things like episiotomies and torn perineums, so worth getting the practice in, I think.
Rebecca will train at Birmingham Women's Hospital's high-risk delivery unit for 3 years before she's qualified to deliver a baby on her own.
Well done, well done.
She'll rely on an experienced midwife to mentor her so she can practice on mums.
Hi. Hi, you Daisy?
Yeah.
Daisy, I'm Rebecca, I'm your student.
Oh, hi Rebecca,
Hello.
how are you? You okay?
I'm very well, I'm very, very excited.
Fab.
To be my mentor as well.
You're going to be with me for the next 4 weeks?
Yes.
Okay.
So is there going to be much for me to do as a student?
Lots for you to do. Have you put anybody on a CTG before?
No.
We'll be doing lots of that tonight then.
Yeah.
Have you done blood pressures and things like that?
I'm not very good at blood pressure, so...
Okay, we'll start showing you what to do.
Wonderful.
Yeah.
I'm very, very excited.
Good. So, here you are. I'm Rebecca. I'm a student midwife. Do you think you could do a urine sample for us and then we're going to go into room 2?
Before she gets hands-on, Rebecca must learn the basics. Daisy has asked her to test a urine sample.
This one's really full, so be careful.
You have to have a lot of patience with a mentor, especially the first year, because they're learning everything for the first time and it's all very new. So you're having to teach them right back at the basics. So sometimes you forget that they don't know how to do a blood pressure or that they aren't sure how to do a urine test.
She's got a bit of protein, but nothing else. So this needs to go in the sluice. Oh. Oh, crap. Oh, dear. She's got 1+ of protein. And I also dropped a little bit of urine on the floor.
Huh?
I dropped a little bit of urine on the floor. What do I do with it?
You wiped it up? There should be some wipes in there, alcohol wipes. If not, there should be some in the room. So
Okay,
leave
I'm
it
going
for
to
now.
disinfect the floor.
Bless her. Her birthday. Hi, you okay?
Rebecca needs to deliver 40 babies under supervision over the next 3 years to qualify as a midwife.
Okay. My name's Daisy and this is Rebecca and we're going to be looking after you tonight. Lovely. You okay?
Rebecca's first mother is Gemma, who's having her first baby. She's high risk and being induced, having developed gestational diabetes.
How are you feeling?
I'm alright.
Yeah?
Ask me that later.
Do you know what you're having? What are you going to call him?
Joel.
Joel?
Yeah.
Fabulous. Excited? Nervous?
I am excited. And when they told me that I've got the bed, I was like, yes! I gave them a cuddle, like, and I think, yeah! And I told them, I'm like,
Oh no.
oh gosh!
Oh,
Right. Do you understand what we're going to do?
Yeah.
We have to break your waters before we start the drip.
Okay.
Once the drip starts, we turn it up every half an hour until you start getting good contractions.
Brilliant.
Okay.
Yeah. Great
Great.
stuff.
On delivery suite, we can't always just have the normal women for Rebecca to look after, so we have to teach straight away the abnormal as well, and that can be a bit difficult for them to kind of get to grips with because they're still trying to get to grips with what's normal, and so to throw in somebody that's high risk and what to do when things are high risk, I think can be a bit too much for people to take in sometimes. Yeah, there we go, they've gone. If it's not too painful, would you be happy for Rebecca to examine you and see what 1 centimetre feels like?
Yeah.
is that all right?
Yeah?
This is the first time that I'm going to be doing a vaginal examination, and I'm hoping Daisy's going to talk it through with me as well whilst we're doing it. So.
I will.
It's this gloves that's the tricky bit.
You think that's the tricky bit?
Yes.
It's good we're not in an emergency, Rebecca.
I know, sorry.
Can you get them on?
Of course I can. There we go, on.
Okay. It's very difficult to feel where the cervix is and how far dilated it is. So just to find the cervix for Gemma now is good enough. That's all I want her to do, is just be able to feel where the cervix is. So you just feel 2 fingers, so
Yeah.
just inside,
Yeah,
and then keep your fingers upwards,
yeah.
yeah, and then you reach right to the back, and you might feel like as if it's like the end of your nose, like a
Yeah.
hard kind of, and it's about 1 centimetre long.
Push. Oh yeah.
And then it's
There
like
we go.
just a tiny little hole. Can you feel it?
Sorry.
So you'll feel, and if you put your finger inside it, you can just press the baby's head, and it's like you can feel a hard head.
Yeah.
Head. Can you feel it?
Yeah.
Yeah.
Feel the baby.
Well done.
Perfect. Thank you very much, Gemma.
You're welcome. Yes, we're on our way, ladies.
Yes, we're going to be doing it. We're going to be doing it tonight. It might take quite a while, but I'm hoping to get a birth. And I've just done my first vaginal examination as well. It went really well. Yeah.
Did you get it?
Yeah, get it. I did. She's really, really nice. They're a really lovely family. See you later. It's only me.
I know I've looked after the women and I know the baby too.
4 hours later, Gemma is in established labour. As a first-year student midwife, Rebecca's role is to support the mum.
I just want you out now.
Oh, I know, Gemma, but we can't rush him out either, can we? He can't come out too quickly.
Do you want to hurt him? I need him out now. I'm ready to go. Daisy, I think I need to push. Oh.
Use the gas, Gemma. Keep using the gas. I'm going to get the doctor. So Gemma's still about 4 to 5 centimetres dilated, so she's made really good progress because it's only been about an hour that she's like dilated another centimetre, nearly 2. But there's some D cells on the CTG, so it just means that baby needs a, might be a little bit distressed. So we're going to get the doctor to just have a little look at the monitor and see what we can do. Okay.
I'm not going to leave the room now. I'm not leaving the room, okay?
Please don't leave me.
I'm not going to leave.
She's just got all these urges to push. I think she's going to be fast. Yeah.
Becky, I need to push. I need to push.
Shall I just quickly examine you and see maybe you're fully dilated?
Oh, please get him out, please.
All right, Gemma.
Gemma, stay nice and calm. Nice and calm. Well done.
If his heartbeat has dropped down, if it doesn't pick up, we might need to go in for a cesarean section.
Yeah, go, please. Get him out, please.
Have you got any questions?
I just want to know. Someone stay with me. Hi, Becky. Is everything okay?
Everything's okay.
Mum, I'll see you in a minute.
Go into theatre.
Mum. Oh, please help me.
Gemma's baby is now in clear distress. The doctors rush her to theatre to perform a C-section.
It was the one thing she said all along, I don't want a C-section. And now she's got to have one.
I will. I'll talk to you. Stuart's here. Hold Stuart's hand, all right? And I'm going to stand. It's probably easier for you to reach round to it.
I've got the shakes.
It's the first time Rebecca will have responsibilities in theatre once the baby is born.
Lots of pushing now. Baby's head is out and baby's here.
In just 15 minutes, baby Joel is delivered safely.
Sounds it. There we go. So just
Congratulations. Baby boy.
Hello. Hello. Congratulations.
Thank you.
We haven't had to do anything. Just dried him off, kept him nice and warm.
Just God, your nanny's going to be so happy. Both of them.
There you go then.
Okay, take him over and let's have a cuddle and let Gemma see his gorgeous face.
Got him?
Little one.
Gemma, look who I have got.
Oh, let's see.
Can you see?
Oh, babe. Oh, look at Lily.
He is absolutely gorgeous. What a beautiful family. So nice to be there and be part of it. Beautiful.
Rebecca has assisted with her first emergency C-section. Now, she must get to grips with her first newborn baby.
Oh, I can't put his little hat on. Come on, Joel. Daisy, do the hats usually take this long to get on? He looks like a slug.
Stretch it, yeah.
Oh, okay. So I had the completely wrong technique. Oh, come on. I can't do baby hats. I will perfect the technique another time. Not on baby Joel.
Okay, so these are the midwifery Oscars. Oh,
For the third-year students at Birmingham City University, it's the end of their academic studies and the last time they'll see each other in class.
Oh, Ashley's crying!
It's only because we ran out of Scotch eggs.
It's an emotional occasion.
Now they must complete their final 4-week placement working in the community. They must prove they can work on their own to qualify as a midwife.
And the scary bit is you're all going to be midwives.
21-year-old Melissa's final placement is with the Quinton Lane Community Midwives.
Hiya, it's Melissa, the student midwife that's coming out to see you shortly. Hiya, sweet. I just needed to get your postcode if that's all right.
When I first applied for midwifery, I didn't realise how much responsibility was there. There's more to just going to uni, you know, doing your essays. We've got that other side of our course where we're spending time on placement, establishing ourselves as a practitioner and gaining those clinical skills that we will need for the job.
Okay.
To be a good midwife, to be able to care for those women and their babies and, I guess, to make a difference.
For the first time, Melissa will be expected to carry out home visits on her own to mums in Quinton, a large suburb of Birmingham.
Well, it's important that all students are competent because it's part of protecting the public. Pregnant mums in the future need to be confident that their healthcare professionals are safe.
Over the next month, Anne will determine whether Melissa is safe to practice on her own. Failure means she won't qualify.
You do worry about going in on your own, don't you? I'm a bit more nervous now we're actually on the way there. I think I'm not nervous myself because I know I can do it. I'm more nervous in the fact that what are the parents going to think? Are they going to be thinking, oh, what's she doing? Is she doing it right? You know? So yeah, once I'm in there, I'll be fine once I'm in there. It's just getting there, isn't it? Hopefully I won't have any shaking hands.
Anyway, good luck.
Thank you.
And I'll see you in about half an hour.
Okay. Bye.
Bye.
I'm looking for the right house that we need to be at. It's a little bit daunting not knowing where I'm going and what I'm walking into. There it is. But you've got to be confident because you kind of have to be. So I'm just going to check. I think it's number... Oh no, actually. I always get the addresses wrong. 51, so we've gone too far now. So that's that. Oh, there. You all right?
It's fine, I was trying to open the window to get your attention.
That's all right, sorry. I thought it might have been you, but I wasn't sure. Are you Lisa?
Yeah, I am.
I'm Melissa. How are you?
I'm fine.
Good.
Well, I've got one concern at the minute. I don't know if it's normal. I did speak to the doctor, but I'm losing like a black discharge. I explained to the doctor the other day, it's not like clots, and it's just like watery, blacky, and there's black bits in it. And he turned around and did say to me, don't worry about it, but obviously if it gets worse, then have a word with the midwife about it. And it is getting a bit worse than what it is, and I don't know what it is.
Bear with me a second.
Okay. It's not like all the time.
Is it completely black or is it red?
Black. No, it's black. I'd worry if it was red, obviously. Sorry, I'm going to have to use the toilet.
It's all right. Hi Sarah, it's Melissa. I'm just doing this booking. The lady's just informed me that she's losing quite a watery discharge, but it's black in colour. I always doubt myself. I think my confidence has grown quite drastically since first year, but I've always had that doubt at the back of my mind to think, actually, can I actually do this? Am I good enough to be a midwife? Thank you. All right, bye. Bye. Okay. This is a very personal question and I do apologise for asking it, but have you had sexual intercourse recently?
Yeah, obviously.
In the past few days?
Not in the past few days, no.
Because it could be old blood, and sometimes it's quite normal to have a bleed after intercourse. I think what we need to do is get you to go and see the GP.
Because I am quite worried because I've had 17 miscarriages.
17?
Yeah.
I'm sorry to hear that, Lisa. It's not very nice, is it? Yeah, so I think that's the best option, is to book an appointment today. And if you can't see anybody today, then you need to try and get to a walk-in GP centre.
Right, okay.
Okay. It went well, but it was a tricky booking. She had quite an extensive obstetric history in terms of her previous miscarriages, the numbers she had. So I almost felt a little bit out of my depth. It is quite scary, you know. It's really hard to think, oh my God, in a few months I'm going to be out there on my own. This time next year, I could potentially be in a blue dress out on the community doing my own visits with nobody to kind of go back to in terms of a mentor-student relationship. I may even have my own student. It is mad, but it's really exciting at the same time.
Spend your life looking for things like scales.
Rebecca is working the night shift on the high-risk delivery unit at Birmingham Women's Hospital.
Night shifts are okay. I've been feeling quite uncomfortable, quite like bloated, and then you feel when you're sleeping, if I do a row of nights, that's 4 days that I'm sort of out of sync, and you feel like nobody else knows that you're there or that you're actually living, you know, in a flat on my own. I feel like I'm quite secluded sometimes, especially doing nights when you're not awake with everybody else. Irina, it's only me.
33-year-old Irina has been on the unit for 5 days, and there's still no sign of labour starting.
I'm on the hospital holiday, you know, I'm stuck here, so...
Do you know what you're having?
Girl.
A girl.
Yeah.
Wonderful. The baby's heartbeat looks beautiful at the moment, so I'm just going to go and talk to the doctors and see if we can start the drip now, and then we'll get things going. Okay, sweetheart. I'll be back in a minute.
Okay, thank you.
To prevent Irina developing blood clots in her legs during labour, Rebecca's first job is to fit her with compression stockings.
Okay, I'm going to try and pop these on. Oh my God. They're tight. You just have to really just pull them
Are these
up.
the ones that have the things inside as well, like a little bit of plastic to help you put them on? Can you do one and I'll do the other?
You can do them both for practice.
Okay. Okay then. These are really difficult to put on, because I've tried them before and failed. Don't worry about lifting your foot or anything, and tell me if I'm hurting you. Just let me know, okay? Sorry, Irina.
No, it doesn't hurt at all. I feel sorry for you.
Grappling with this sock.
I feel like I want to help you.
Oh, no, don't worry.
Rebecca's always worrying at the little things that she, you know, is she doing it right? Is there anything she could do better? Has she done it wrong?
You see the concentration on my face?
Sometimes the best way to learn is just to go and do it, and sometimes I think she holds back a little bit and thinks, oh, let me watch you again and then I'll try next time. But I think sometimes the best way to learn is just by going and doing it.
To be done around. Yeah. Well, thank you very much.
There you go. Ted stockings on. Is that done okay?
Yay!
You do leave it like that though, don't you?
We usually put it over the toes, but some people like want their toes out to...
Oh, actually you can do it for now.
Yeah?
Yeah. Simply looks nicer.
It looks
there you
nicer.
go.
It's all about how you look today.
Definitely.
Many first-year students, like 19-year-old Molly, are unlikely to have set foot on a maternity ward or witnessed a birth.
I don't feel like I should be allowed to do this for another few years yet, but they just kind of chuck us in. So all I can really do is what they show you on film, breathe, breathe. That's it really. I saw someone have a cesarean section on TV, on casualty the other day, and it did scare me a bit. So, and that's completely fake, so I'm not looking forward to that. I don't know how I react in theatre. That's one of my worries. Because I've seen a birth before, and I've seen the crash team have to come in to a birth before, but I've never seen anyone be sliced open yet. So I don't know how I react to that. It's a bit squeamish of that, I think.
Molly is being mentored by Kathy Jones, a midwife with over 10 years' experience at the Women's Hospital.
Just to remind me where you are and what you've done so far. First year, first placement and delivery.
First placement and delivery today. Have you had any deliveries at all?
I've seen 2.
Seen 2, okay, we're going to go. Because it's very difficult to get work experience in this sort of area. You know, you've had little or no exposure to this kind of environment at all before your first day, so you really don't know whether it's going to be something, you know, you think you've got an idea that you know it's what you want to do, but you can't really know until you start doing it.
Molly is assisting with Suzanne, who's having her second baby.
The good news, well, I don't know how, you're fully dilated, okay? Because I would probably, at this stage, wouldn't necessarily do your epidural. Okay, so
it's too late for pethidine.
Yeah, it wouldn't work, Don. I think you'll have a baby before.
It's too late.
It is, I'm afraid, at the moment. Yeah. Okay, but you'll be fine. Soon.
Doing great with the gas.
You're going to be fine. Okay, we'll look after you. I know this is not what you wanted, sweetheart, but you'll be fine. Give me a push, then. Give me a push. Okay.
Hi Suzanne, my name's Dr. Shearer, my registrars. So the baby's heart rate's still quite low actually, Suzanne.
Yeah.
Okay, so I think what we really need to do is get the baby delivered.
The doctor will help Suzanne deliver her baby by ventouse, a suction cup placed on the baby's head.
Okay, we only get 3 pulls, okay? So you must push, just like you just did, okay?
God, this is all going really quick.
I know. Fantastic job, Sue, okay?
It's coming
Great
out.
big push till he tells you differently.
Push.
Good girl, well done.
Keep going.
Great job, well done. Keep going. Fantastic, well done.
Okay, just stop there for a sec. Nearly there, okay?
Yeah.
So next contraction, we should have the baby delivered.
Is this coming?
Yeah, it feels like it's
Yeah, you know before we will.
Yeah.
Go on then. Great big push, darling. Listen carefully, keep going.
Keep it going.
Well done, Sue. Doing brilliant. Get ready to blow.
And another push for me.
There we go, great. Head is born.
Well done, mate.
Oh my God.
That's her head out. She's
There we
here.
go.
Okay, stop.
Good girl. Hello. Birthday.
Oh, beautiful.
Happy birthday. There you go. Well done, darling.
There we go.
9 minutes past 5, okay? Oh my God. Well done. You're a superstar. Well done.
As Molly deals with the baby, the team attend to Suzanne, whose blood pressure has suddenly dropped.
I think you feel a bit rubbish because your blood pressure's a bit low. Okay.
Can I just re-examine you again, Suzanne, just to make sure there's no more clots in there?
The problem is, if there's lots of clots in your womb, it doesn't contract properly, so it doesn't work very well. And it fills up, and you're bleeding, and we can't see it coming out, but you're bleeding onto the inside, and that's what can make you feel unwell. So we need to make sure that that's not what's happening. Okay. Molly, just go more back.
Sorry, Suzanne, you're doing great. There's clots in there. Lots.
Keep that arm down there.
Suzanne is hemorrhaging, a rare complication that can happen after birth. The team must get the bleeding under control, or it could prove fatal.
Suzanne, are you okay? You're shaking, you've just got quite a bit of adrenaline at the moment, okay? lessened a bit. We'll keep an eye on it, alright?
Suzanne kind of went very shaky and pale, and her blood pressure went down loads, and her heart rate kind of raced up. That was quite scary, just because I knew that low blood pressure, and with the amount of blood that she'd lost, and with the raised heartbeat, that there was something definitely wrong. In an emergency situation, everyone's busy doing what they're doing, and they kind of explain it to the students after. They just ask them to go and grab little things, so then you're kind of there in the unknown about what the situation is and what's going on, which is quite scary.
So we'll send off these bloods and we'll just see what's going on.
For Molly, who during this placement the idea is that you get as much exposure to normality as possible, wasn't quite what we had planned, but I do think it's really important for the students to appreciate that normal's great, but normal isn't for everybody and normal isn't every day, particularly not when you do training in a unit like this.
It's kind of taught me not to kind of trust the situation until it's properly safe and handed over, that you can't kind of relax completely and think that everything's okay. Even if they look fine, they obviously aren't always all right.
Third-year Melissa is on her final work placement as a community midwife in Quinton, Birmingham. Here, she'll run her own antenatal clinic with sole responsibility for a full list of patients.
Having lunch.
She'll have to give appropriate care and run to time, whilst mentor Anne takes a step back.
How are you feeling?
This is a big responsibility for Melissa because this is the first clinic on her own, and in a few months' time she'll be expected to do a clinic by herself without any backup. So it's good that she's getting the experience conducting her own clinic with me on hand in the room next door.
This is a crucial part of her practical assessment. Melissa must pass this stage to qualify as a midwife.
Anna's here today, she's just in another room. She's letting me be a midwife for the day. Everything I do today has got to be right because the women are going to look at me and think she needs to know what she's on about. I don't really want to feel like, oh, actually, I'll go and ask Anne. I want to be able to do it on my own because it was one of my objectives for this placement, so fingers crossed. Amy Mitchellins.
Her second patient, Amy, is only 15 weeks pregnant.
Your first baby.
She's never heard her baby's heartbeat before.
We can try and have a little listen in today to your baby's heartbeat, but because they're so tiny, there's no guarantee that we will be able to hear it. So it's completely your choice, because I don't want you to go away thinking something's wrong if I can't pick it up.
If you
can
have a go, that would be lovely.
Take a seat on the couch.
Even for experienced midwives, it's not always possible to find the baby's heartbeat at such an early stage of pregnancy.
Sorry, I've got cold hands.
That's all right.
Is baby moving around? Do you know what? That is the most clear heartbeat I've picked up in. It's good work. Pro.
Yeah, very good.
Thank you, Amy. Take care. Bye. Oh, it's amazing. That is the most clear heartbeat I've ever heard that early on. She seemed really, really happy. Her face, she had a big grin, didn't she? It's nice to be able to make somebody smile like that. Got it! Patricia, hello. Sorry to keep you waiting.
Melissa's next patient is 22-year-old Patricia. Her pregnancy is overdue, so she's been having regular checkups with the midwives.
How are you feeling?
I'm all right, but just lots of pain, like on this side, going down.
Have you been feeling baby move, Patricia?
To be fair, from yesterday, don't want to move.
Not at all?
Absolutely.
He's so lazy, I know. But
Is it normal for him?
Not from yesterday.
Not from yesterday, okay.
Yeah, but always it's like moving maximum 2 or 3 times a day. He's so lazy.
Apart from yesterday, he normally has good movements?
Yeah.
Okay.
Yeah.
We'll probably send you up to triage then and get that checked out. All right. We're always concerned whether fetal movements have changed or reduced in any way. That's not to say it's anything wrong, but you just don't know. You know, a baby can't tell you what's wrong, so it's better to be on the safe side. Do you know the seriousness of fetal movements? Did you try having a cold glass of water and sitting down?
I'm trying everything.
If that doesn't happen after a few hours, you must call triage.
All right.
Okay? Because we don't know what's going on in there. Hiya, can you put me through to triage, please? Hiya, it's one of the students in clinic. We've got a lady here who's not felt any fetal movement since 2 a.m. It's her first baby. All right, thank you. Thanks, bye. Right. So just make your way there when you're ready. Okay. Okay.
Thank you.
Okay. Bye. Take care. Now she's left, I think I'm going to be sort of thinking about her tonight, and I probably won't be able to sleep because my mind goes into overdrive. You just don't know. And I think that's what's most scary. Pregnancies are so unpredictable. You just never know.
Three hours later, it's clear that Melissa has made the right call. Patricia has been rushed to theatre for an emergency C-section.
Patricia's been rushed around for a Category 1 C-section. It did happen really quick because she came in today in triage to be induced for reduced fetal movements, and then obviously when we put her on the CTG, baby's heart rate went down. So the doctors made a decision to come round to theatre and give her a caesarean.
Congratulations, well done.
Don't cry, sweetie. We are together now. Yeah, don't cry. Don't cry.
How are you feeling, Dad?
Stress.
Everything was fine by 1 second. The heartbeat's gone, and automatically they press some bells, and lots of doctors came and says you need to do cesarean. So they do the cesarean. We are here, and he is with us. So stressed, but so excited at the same time.
Knowing that, you know, you've played a part in the outcome of somebody's baby, you know, sending them to triage and knowing that she hadn't felt a baby move for 12 hours is a huge responsibility. To think that if I hadn't sent her, you know, would the outcome of that baby be as good as it is now? It's quite overwhelming knowing that if you're not doing your job properly, you know, things can happen. You cause harm.
Bobby?
Rebecca?
Yeah. Do you want to room 15?
Yeah, lovely. Thank you.
Nearly 3,000 babies will be delivered by students at the Women's Hospital each year.
It's for suturing, isn't it?
For breastfeeding. Do you sit on it the other way around?
What is this for breastfeeding?
Not for the woman, for you, assisting her to breastfeed.
Oh, right.
Rebecca is working the night shift with midwife Bobby.
9 o'clock.
Like 5:30. And it's fine, the time goes really, really fast. It will. Night shift midwives, can we come in? Hello.
they're looking after Janine, who's having her second baby.
Can I just feel your tummy? Is that all right? You continue on the gas and air. It's a nice strong contraction you're having. Keep going on the gas and air. You're doing really well. That's the third in 5 minutes.
Just 2 hours into her shift, Rebecca has the chance to assist on her third delivery in 2 weeks.
Well done. Well done. I know. Hang on in there.
Janine, do deep breaths on your gas and air. It's not so much distressing. The bit that gets me is when the decibels go a little bit too high, and it's more sort of just hurting your ears, and you're very close to that woman, and you have to then go closer to them to encourage them whilst they're still screaming. So it's not actually the fact that she's screaming, it's just the actual noise and the impact on my ears that I find quite hard. Just sit up for me again, because you've gone slightly sideways. It's hurting.
It's comfortable here.
It's comfortable here. Well, we'll need to be careful that you don't roll off the bed.
Can I examine you in a minute? Because you're pushing, aren't you? I know you are.
We can tell, Janine, that you've started pushing. You have, haven't you? Yes. You have.
How do you feel about getting hands-on with this delivery if we get there? Do you want to?
I've done 2, so yeah, I'd really like to.
Wicked. Perfect. I'm glad that you want to. That's good. At least you're not shying away from it. Do you mind just pressing the call buzzer as well, just for an extra hand? Janine, I think I can see the tip of the baby's head. Okay. So if you have another contraction, give me a little push. Go on. That's it. Go on. I think there is. Well done, you.
Janine, keep these knees up for us.
Go on. Keep on. Go on.
That's it, Janine. Open up your legs as wide as you can. That's it. Well done. Well done, Janine. Well done.
Don't push, just blow. Don't push. Lovely. Heads out. Well done. So just wait. You have to touch. Don't just because. Give us another push.
Well done. Hello, little one. Well done.
Baby!
Here's your baby. She's beautiful. Beautiful, beautiful baby.
Oh my god.
Well done! That was amazing! I've loved every minute of this placement. I have, even when you're tired and your eyes are streaming because you've done too many nights, it's still loving it, really wonderful. You can just watch families change. You have sort of mums in the room that are then grandparents and new parents, and everybody's so happy, and it's just a really nice moment to be part of.
I'm so happy you're here.
I'm well proud of her. It doesn't get much better than this. This is just a cherry on the cake of life, really. It's just banging. I was really promised banging.
I obviously don't know everything just yet, but the more I learn, the more I can help. And that's what I want to do. I want to help people.
One of Rebecca's final duties is to make tea and toast for postnatal mums.
Oh no. What's stuck to the side?
I've just annihilated the toaster.
Do you know that the toaster is one of the most important pieces of equipment in the whole hospital?
I was very aware.
If you tell a postnatal mom that she can't have toast, that's one of the biggest emergencies.
They're going to hunt me down, aren't they?
Yeah. Run and hide, Rebecca.
Pull back again and make sure that there's no air bubble in the top. No, that's perfect. And while you're a student, you can ask anything.
I'm always asking you questions.
You are. And there's never anything a silly question, really, because it's never silly, is it, if it's bugging you? And you're better to ask it now as a student than to be coming when you're qualified, because once you qualify and you do your little bit of rotation, it's like you feel, I think most students feel, I can't ask that, I should have known it. And it could be a scenario happens that you haven't actually seen, and you could be qualified a year, months, you could be qualified even longer. Never be complacent, because there is always a time when you'll meet something you've never met in your before.
With no guarantee of work after graduation, the competition for a job is tough.
Now I'll update that for you as well.
22-year-old Hannah has swapped her student whites for blues, having got her 40 births to qualify as a midwife.
It was the best feeling in the world when I found out I'd got the job here, because it was where I really wanted to work. When you've got your white uniform on, you've sort of got that to hide behind, and your mentor, you've got them to hide behind. But now you've got your blue uniform, it's completely on you. Which side is it you're getting your pain on? Is it your right side, isn't it?
I think when you suddenly see the girls that you've trained and that have been your students, and you suddenly see them in blue and they're all qualified, it makes you feel really like, oh, they made it, look at them, they did it. And you know, because you've done it yourself, what they've been through to get there and what they've achieved. So you've come so far and you know so much, and yet it's just the beginning, so it's scary.
It's Irina's 6th day on the unit. Her contractions have now started, and Hannah will take charge of the delivery.
Right, and what I want you to do is we'd like you to get 3 really good pushes with each contraction that you have. So what you need to imagine, it's going to sound not nice, imagine you're really constipated and you really need to go to the toilet. Just chin on your chest and just big push down into your bottom. And fingers crossed we'll see this baby. Is that okay?
Yeah.
Okay, getting one now. That's it, fab. Excellent. That's it, keep it going. Fab. I'm really excited that this could be my first birth in my blue uniform, and it's really nice to be able to share it with a family that you've been looking after for a while, and you've really got to know them. You've actually got another one now. The more you think about it, the more nervous you get, but fingers crossed it'll go nice and smoothly, and we won't need any help, and she'll have a lovely delivery. One more. Oh, fantastic. Well done. Brilliant. Excellent.
Hannah can only let Irina push for a maximum of 2 hours. Any longer and the baby could become distressed. With Irina close to her limit, Hannah needs to deliver the baby.
You're doing absolutely fab. Be proud of yourself.
Still slowly.
No, it's not going to come quickly. Babe, this baby wants to take its time. Are you able to push again for me? That's it.
Big push, right.
Excellent.
There we go, heads
done.
out.
That's your baby's head.
Heads out.
So with the next contraction, what we're going to do is deliver your baby.
Okay. Got one brewing now. Big push for me.
Big push.
Yeah.
Okay, push, yeah.
That's it, keep it going, keep it going.
Come in.
Don't know if the shoulders or not.
Neck free.
The neck's free, but... Can you push again for me? There we go.
Oh! Well done.
Come on, baby.
Come on.
Come on. Come on, baby. Come on, baby.
and it'll be a shock. Do you want to cut the cord?
Yeah.
Come on. I'm going to press the cord down. I'm going to press the cord down.
Pull the emergency buzzer.
Thank you. You got it?
Yeah.
Turn it off now. It's all right.
No, he's having a go.
It's all right now. Yeah, it's above 100.
Tone's not brilliant. Yeah, we probably could do with the tune. Just bleep like normal.
Come on, sweetheart. No.
Tone's improving.
Come on, darling. No. Just keep it warm a bit. Come on, sweetheart. No.
Tone's improving.
She's come out a little bit shocked.
Oh, she's lovely.
She's fine.
When you see that they're starting to respond to what you're doing, it's absolutely amazing, because you know that what you're doing is obviously helping that baby, and you know that baby is now a well baby and not one that's going to potentially need to go to the neonatal unit.
Come on, sweetheart, let's go skin to skin with your mummy.
Don't get any gases. Congratulations!
It's all right.
Tired, very tired, want to sleep. Let's see. How much? We will sleep in the night time? Yeah? Well, still will be better this night than the previous one. No, you can't.
How you doing? Well, I got a delivery, so first as in blue. However, baby was born flat as a pancake.
Oh no.
Didn't respond to any stimulation at all. So I had to call the emergency buzzer, take to sister tear, 5 inflation breaths, and then it did respond.
Bless you.
I know, so it was a bit... I mean, the head delivered really slowly.
So was it? Yeah.
We delivered at sort of the eyebrows, and then it took a while to get the rest of the face out. So I don't know if that had anything to do with it or not. I thought it did.
Well, it can if it's sitting there for a little while.
Yeah,
it can. But usually they respond fairly quickly.
Yeah,
They try
this
and
one
everything.
did not.
No. So Hannah, was that the first one then for you, love?
Oh, bless.
See, but you did it, sweetheart. First of many, and we get better and stronger and.
Yes, and if I get another resuscitation now, I feel a bit more confident.
Of course you will, of course you will.
Yeah. I'm going to go home and eat lots of chocolate to relax, because I'm absolutely knackered and emotionally drained today. So I'm going to go home and eat lots of chocolate. Oh dear! You did cause us some grief, didn't you? Yes. Yes, you did. Daisy, these are for you.
Oh, with these Ferrero Rocher, you are spoiling me.
They're my favourite.
It's the last day of Rebecca's placement. In just 4 weeks, she's delivered 5 babies.
That's so nice. Thank you. That's really sweet of you.
I'm not going to do it for all my mentors. You're my first
Just me.
mentor.
Just me. And when you have other mentors, just buy me the present.
Rebecca must have had another mentor recently. Another box of Ferrero Rocher. That's such a good idea.
Rebecca has a confidence about her, and this lovely kind of fresh kind of confidence that not many students have. I think because some of them are a lot more frightened than she is, but she seems to have overcome that quite quickly, and that's really nice, I think, because it doesn't hold her back. I'm going to miss her. I've really enjoyed working with her. She's been really, really lovely to teach, and I think she's going to make a really fabulous midwife.
Good luck. Give me a hug.
Thank you, Daisy.
Take care. And I'll see you soon. And if you're ever worried about anything or need anything, just give us a call here and you've got my number, so call me.
Thank you so much,
luck.
Daisy.
Bye. Bye.
Excellent attitude, good communication skills, in fact they're excellent.
It's the moment of truth for Melissa. Today, she'll find out if she's done enough to pass her final placement.
So well done. We've awarded you a grade of 80.4, which is excellent, which is an A grade, so well done.
Thank you.
Do you want to comment on anything? Are you happy with that result?
Yeah, I'm really happy. I just want to say thank you for making this last placement a really good one.
Oh, bless you. Kiss.
I'm really thrilled. I wasn't expecting an A grade. I was hoping to get at least a B, but yeah, it's nice to know that somebody's had that much trust in you and supported me to be able to gain an A.
She's done really well in this last 4 weeks placement, and she's an outstanding student, and I'm quite proud of her because I'm part of that process. So I'm really pleased.
Oh my God, it's the last ever placement that's going to be ever assessed, and I got an A! Just never thought I'd get here. Having a baby is one of the most amazing things that anybody could have, and there's so many people out there that can't go through that themselves, and to be part of that experience for somebody is a real privilege. It's a real privilege. Getting all emotional now. I guess it's just hit me that it's come to that point now where I just want to get through it and finish it and be able to make a difference to the public and provide that care for women and their families and be a midwife. Lovely to meet you.
Thank you.
Take care. Goodbye.